Hello, everybody. This is an HCC training course for version 28 and some of the changes that we've seen regarding depression coding. So today, I'll talk to you a little bit about version 28, and we'll specifically talk about the depression codes. You'll also have an educational tool that you'll have access to. I've screen capped that tool, and I just wanted to go over it with you in this 5-minute video. So version 28, right now, in the past, we've had version 05 of HCC coding and version 24. And in 2024, we turned over to version 28, which had some substantial changes in it. Now, what you're seeing right now is essentially a screen that shows us specifically what does have an HCC and what does not have an HCC any longer in version 28. Now, in the far right-hand column, where you see the word yes and no and yes, yes, these are the version 28 rules. So you can see here that depression, single episode mild, does not have anything specifically in its column anymore, because that means no in version 28, there's no HCC risk bucket for that. So long story short, anything that was major depressive disorder, single episode, mild, has been eliminated from version 28, which is sad because we spent a lot of time in version 24 asking providers to quantify the type of depression. So anything now that reads mild, or in partial remission or in full remission, or here's another mild, F33.0, we would encourage you to use the appropriate ICD-10 code. But if for some reason there's a patient who is moderate or severe, if you document that correctly, then we will get credit for it. But this was a major blow to us when it comes to depression coding. And again, you always want to stay away from depression unspecified, because that again carries no risk value. The reason I have bipolar at the top, F31.9, is bipolar unspecified. If you can't quantify if it's bipolar 1 or bipolar 2, that still does have a risk bucket. So risk bucket 154, 155, 152, these are the only codes this year that have an HCC under depression. Still, if you quantify mild, that's fine. That's what you need to do from a compliance standpoint. But moderate and severe does carry a risk bucket. So the educational tool that you get is just kind of a little bit of an overview, not just for the physicians, but also for the staff. And you'll see some information from the APA about a minimum of 2 weeks or showed at least 5 of the following symptoms. And that's major depressive disorders. And a lot of people always ask us what the difference for those two are. And then in the second paragraph, you'll see that risk adjustment is only assigned in V28 for patients who have moderate or severe depression, single or recurrent. So there is no risk adjustment for mild or unspecified. Now, this again kind of summarizes it even better. Now, this will be in your supplemental handout. This will be in the middle, and this shows you all the different codes that you might use and the ICD-10 codes that correspond with those, as well as whether or not there's an HCC. So in this first column, you can see that everything that we had over here used to have an HCC. All of these used to have an HCC. Now we can just simply see that, we only have 152 and 155 on a handful of these HCCs. You're also going to get some documentation recommendations within the policy. So this type of episode that you want to make sure you're documenting if it's single recurrent, if it's intense, mild, moderate, severe symptoms, or severe with psychotic features, and its clinical status in partial or full remission. That should all be recorded from a compliance standpoint in order to support the HCC. So we talked about version 28 and how it has eliminated several risk buckets for depression, specifically still mild is new this year and unspecified still remains. We also talked about the specific depression codes that you commonly would use, and that's going to be in your supplemental handout. And if you have any questions about this, feel free to reach out to me anytime. Any member of CAP, your coder who's been assigned to you, all of us are willing and desiring to try to help you understand and navigate version 28. And I hope that you found this video helpful. Have a great day.